POA and Fit Body communities. What's up, everybody? Welcome back. Robert Linkle, trainingtheolderadult.com. And we've got a good one here for you today. We are going to dive in. So this has been, number one, this is a kind of a personal topic for me because this is the first injury that I experienced, lower back pain caused by years of throwing and lifting and doing just damaging massive amounts of overtraining in my body that create this sciatic discomfort and pain that is so miserable. This started for me in 2004 and has continued all the way until now. I am currently in a pretty decent flare up with my lower back. And we've had multiple people around our community of TOA people that have been experiencing this too. We've had affiliates and other members and other clients, etc. So it just seems like a good time to get into this. The reason I'm starting this way is when you're going to hear me talk about some of these injuries and these pains and this discomfort, it's coming from a personal experience in that and in a current state. So this will be a little different than our normal kind of researched, hypotheticals about bunions or whatever it is. I haven't experienced those. This one I am currently experiencing, and we'll be able to share quite a bit about this as we go through, okay? So, as always, we want to take in what we can of understanding what an injury is, and then how can we utilize it as coaches in the weight room. What should we do specifically to assist a client that has lower back pain, sciatic symptoms? What can we do with them specifically in the weight room to help improve their quality of life? Our job is not to diagnose this injury. That's already been diagnosed. We know what they have. I just want you to have a better understanding of what that is, and then, what we can do about it. Coming from the world of the resistance training, strength coach / personal trainers. First off, looking at the anatomy, the way that a healthy spine and vertebrae and vertebral disc should look, that picture on the top left. The vertebrae are nice and marshmallowy, and the discs in between are full and plump, and they all look really comfortable, designed for good vertical compression, etc. When you get arthritis or osteoarthritis, you start to see where the bone itself of the vertebral columns start to erode away. They get rather porous, and then they start to work and deteriorate basically the disc itself. And eventually you get to a point where the disc is really compacted and smushed down. And then if we look at the picture on the right, bottom right, as the disc continues to push down, at some point the pressure has to go somewhere. And the best analogy that I've used for this, my doctor told me about, is a jelly donut. The jelly donut, when they made the donut, it was complete and it was solid. And then they said, we're going to fill this with something. So they shove in the little hose that they're going to then squirt in the jelly. There's now a spot in the donut that has vulnerability. And when they squirt the jelly in there, it fills up the inside. So if they push down on the donut, where do you think it's going to come out at? It's going to come out of that vulnerable spot where it came in. That's kind of the idea here. At some point, and it's because of our posture and the way the world is happening in front of us, basically we are either too round or too tilted over or internally rotated, pelvic tilting forward, that the vertebrae, as you see in that picture there, the vertebrae start to curve. And when they do that, all these pressures that are compressing straight down start to manipulate and they start to kind of deviate. And if you push down on a jelly donut and to the right, where's all the jelly going to go? Ideally to the left or towards that vulnerable opening. And in this case, what happens is wherever that vulnerable opening is, the disc is going to start to push out. And so now you have a bulge. And then eventually it's going to blow out. And now you have a herniation. Okay. And that's the picture there. I'll zoom back in on this a little bit where you can see right there in the middle. Okay. You've got this happy disc and then the herniated spot blows out. And once it's out, you can't put it back in. There's nothing's going to retract it. If you have a bulge, bulges can retract. But once it herniates, it like completely ruptures and it's out, you can't put it back in. And so now it's pushing all that red area, it's pushing on that nerve. And in this case, it's the sciatic nerve. And you can see where the sciatic nerve stems from L3, 4, 5, all the way down to S1. And so if you have injuries there among any of those discs, it's going to interrupt that signal that goes down your leg. And that's going to go down basically the hamstring side of the posterior chain. And it's going to split. It'll kind of wrap around your calf in a couple areas. It goes down the outside of your foot and all the way down to your toe, typically the pinky toe. So this injury is, and it's weird because the actual injury is up in your back, L3, 4, 5. But the symptoms and the pain is in your butt and down your leg. When you relax and when you're laying down or when you're perfectly vertical standing up, depending on where the disc herniation is, you may have more comfort when you're vertical. And then when you sit down, it just lights up and it hurts you. Or it might be the other way around. When you sit down, it feels better. When you stand up, it lights up. In most cases, it's going to be one or the other, or certain positions of either position, right? Certain instances for either position where if you lay too long or if you stand too long, then it starts to flare up, it starts to aggravate. There are some remedies, and we'll talk about this, for developing some relief. Where things get tricky is, in my case, a lot of the relief is done through tractions or other things. When you have hip replacements, a lot of that stuff goes away. You can't start tugging on your legs because your hips will dislocate. So there are some tricky components that start to come into this to say, boy, we could do some things that could really help, but due to other ailments, now things are rather restricted, okay? So this is an article, I'll put the link in the description where you can go in here and check this out from Ann Asher. She's an ACE certified personal trainer, and this was in October of 2023, okay? So she goes into basic understandings of what sciatica is. And as we kind of discussed, it's the deterioration of a disc to a point where eventually something starts to bulge and or herniate. And then we now have this effect that is going to trickle down and have just kind of a rather severe impact to your day-to-day. And it's quite uncomfortable and it's quite constant, and it can be sharp and piercing. And then you can have moments where it's just this dull tingle that just nonstop. So we'll dive into that a little bit. Sciatica occurs when there is a compression along the sciatic nerve, resulting in pain or various symptoms down the lower back. The sciatic nerve is the longest nerve in the body, and it runs from the lumbar spine, L3, 4, and 5, S1, all the way down, branches off down to the lower leg, all the way down into your foot. And when it's compressed, irritated, or inflamed, here are the symptoms. Sharp burning pain in the upper buttocks. You can get shooting pain in your back. That's pretty rare, but mostly in your hip and your butt and the outer side of the leg. You get tingling or pins and needles sensation. Mine, unfortunately, and you may see it when I'm doing these videos, you'll see me reach down on occasion and touch my legs because my sciatic symptoms have these little tingles where it feels like something's on me, like a fly or a bug. And so it's me basically checking to make sure I don't actually have something on me. And a lot of times I just have to touch it to basically get my mind over the whole idea of like, yeah, there's nothing on me. It's just my back tingling. It's, again, one of these things that it happens all day long, and it's rather aggravating. Risk factors here, they basically, if you're over 50, you've had 50 plus years of degeneration and deterioration and abuse, in a way, we'll say abuse of just 50 years of living, right? You're moving on a daily basis, active, or you're sitting way too much, inactive, it just depends. Obesity, if you're carrying extra body weight, if you smoke, that degenerates a lot of the ligaments and the tendons and the discs variation, the intervertebral discs, the facet joints, all that is affected greatly by smoking. So A lot of individuals, I would say a great majority of folks with lower back limitations will also see correlations from smoking. If you've gone through pregnancy, all of a sudden you're 135 pounds, and then you add a baby and all the extra body weight that comes along with that, you're 185. All of a sudden you've added 50 pounds, and then you have to carry that around with you for 3, 4, 5 months as you progress. That's just a ton of load all of a sudden, right? That's a very quick increase, and it's all in one spot, basically, all in front of your belly. And so your lower back is just continually taking that load to hold the baby in place. This is a very common symptom of pregnancy. And then in most cases too, once the baby arrives, the sciatic symptoms will reduce, but in some cases they don't. It's now caused damage, and you'll have sciatic symptoms for a while, if not chronically. And then occupation of sport where back muscles and heavy weights are involved. Yeah, that's a very good indicator. For my situation, just years of throwing and lifting and repeated motions. And then when you're a thrower, you're throwing heavy implements. So not only are you lifting and throwing, you're lifting and throwing something heavy. Like, it all combines for imbalances and pretty good opportunity for injury to occur. Sciatica is treated with physical therapy, over-the-counter anti-inflammatory medications. You can do cortisone injections, and then in some cases, yeah, you will need surgery. Okay, I've had all of those. Physical therapy and physiotherapists involve different modalities to treat the root cause of sciatica and relieve symptoms. These treatments may include electric muscle stimulation, STEM. This is a good response. This typically does help quite a bit. You'll find a position that you're comfortable in, and they'll hook up 2 little electrode pads, usually one on your upper butt, lower back, and then the other one down your leg. And they'll send an electrical current through that from one pad to the next to stimulate the musculature along that route. And it can be in small little waves. It'll get bigger, 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 less, 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 or it'll go zap, 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 zap. And they'll just have repeated little stimulus there to try to help ignite, if you will, the signal of the musculature. And then the little zaps over and over again, or stimuluses of it, encourage the muscle to activate. And so if you have any muscles that are atrophying, because this is a nerve that is sending signals of this muscle to activate, you might start to get a toe drag or a toe drop, and some of the muscles in your leg will then start to deteriorate or atrophy. The electric stimulation can help stir those muscles and like get them engaged and working again. And not to the point where they'll grow, but at least where there's some stimulus to them, can be rather therapeutic. Hands-on therapies like massage, trigger point therapy. We've seen dry needling, acupressure, acupuncture, even float, salt water baths that you can lay in, all that, hydrotherapy, ice, heat. It just depends on the individual. Try anything, all of them. Muscle strengthening exercises for core, we'll talk about that. And then there are very specific stretches, okay, that we'll get into as we look at that. Exercises to avoid. This one is tricky because you can look at this and go, all right, you should probably not do bent over rows. You should probably not do barbell back-loaded back squats, right? Or heavy front squats. Like, there's certain lifts you could look at and go, this is probably going to aggravate your back and hurt you. But in some cases, depending on what direction the herniation goes or the aggravation of the disc goes, some people find some of these movements to be just fine, and others it really is aggravating. Some of the therapies and the exercises suggested to help improve you, I do them and instantly my sciatica just explodes. It's so miserably uncomfortable. Like, I'll show you a few. There's no way I could do these. The second I do them, I'm ruined. And for others, it's immediate relief. So as we kind of go through this, kind of take it with a grain of salt. Like, yeah, maybe 80% of this is pretty much right on, but it's not going to be the case for everyone, okay? So bent over rows, or any position where you are stressing or stretching the hamstring, as the next one down there, via a posterior chain activation of the lumbar spine under stressors. So hinging into a stiff leg deadlift, a good morning, or a hinging row position can be very aggravating. Any forward bending where you're rounding your back, trying to touch your toes, going down into, sun salutations, that kind of stuff, all that could be very aggravating. laying on your back, trying to lift both of your legs at the same time. Very stimulating on the sciatic nerve because your iliacus and your psoas, the iliopsoas muscle, both originate right where those nerves are running through and insert along the path through the front part of the hip towards the medial upper greater trochanter of the femur. The nerve is running right along a very similar path. And when you activate those hip flexors, it's going to pull or activate the musculature around the disc that is around the vertebrae that then is going to move and manipulate the disc in between. Basically, you're taking the origin of a muscle and it's pulling the bony parts together that are ultimately causing this problem. And then you're going to do that over and over and over again, attempting to do a leg lift or a sit up or anything like that. This is just anytime you're bringing your sternum and your pelvis closer together, like a crunch or sit up, you're really encouraging that injury to get worse every single time. Squatting, full range of motion squats, if you were able to go too deep and then start to tuck your butt, some people will squat and feel just fine, but most are going to squat and start to get some aggravation. So being careful there. Traditional deadlifts typically are going to be okay-ish. Your stiff leg or straight leg deadlifts are probably going to be more problematic. Leg circles, I don't know about that, but like swinging your legs back and forth like you'd see runners do when they're getting ready to start off. And then high impact, anything where you're running, jumping, bounding, burpees, horseback riding, anything where there's high impact, up and down, that's definitely going to aggravate you for sure. And on the other side of it, we've got some exercises. We'll talk about these here, which ones you should be doing. So this is kind of the funny ones to do. Plank variations for sure. Pull-ups, there's a traction component to doing pull-ups. I think that's very good. The bridge position, look at that. If I attempted to do that, my back would just explode. Number one, I don't have the mobility, but number two is that inverted position like that. The second, if I do a Superman or any type of extension, I just explode pain down my leg. So that's one of the ones where like a traditional glute bridge, yes, but that kind of like like acrobatic slash, gymnastic bridge, probably not the best. Lunges, fantastic. Lunges are probably one of the better ways to keep your legs strong. Lunges are how, and split squats are how I've been able to keep size on my legs, along with belt squatting. That has working with this injury has been able to stay functional, but really, your days of heavy deadlifts and heavy back squats and heavy front squats, those are all behind you. To avoid the leg press, probably one of the worst ones because of the pelvic tilt position, the range of motion, the back position of a leg press is already really difficult to be in. And it's a good full range of motion controlled movement, but the positioning is really difficult. You're better off just doing quad extensions and hamstring curls in this case, as opposed to kind of forcing yourself through leg pressing. Any kind of deadlifts, I love how they put a person doing a clean and jerk on there for deadlifts, but any kind of deadlift, pulling the weight off the floor is going to be pretty challenging. Traditional squatting, overhead squats, etc. And then any overhead pressing is also going to be really difficult. It's an alignment position of vertical loading, axial pressures that are going to be really tough. Other exercises to avoid. Top right up there, they show you that straight leg, stiff leg, hinged position, and then any type of sit-up position. Those are going to be challenging. Your rows, your sit-ups, it's all abdominal based there on the sit-up. That's going to pull on your lumbar to help you get up. And then in that hinge position, you're preloading the hamstrings that are going to aggravate, probably in most cases, that sciatic nerve running down the posterior chain. This abdominal stretch, see that cobra stretch the girl's doing there where she's arching up her back? Like that's, again, another one where sometimes in therapy that's given as a suggestion. And again, it just blows up my back. So I would be careful with those for sure. Heavy deadlifts, shows a picture of a girl squatting, but again, axial loading, vertical pressures, any type of weightlifting, snatches, Olympic, clean and jerks, those types of lifts where you're getting a lot of vertical pressure, vertical axial loading, and then holding weights and or pressing them overhead. Very challenging there as well. And then your leg exercises, as they put down here, like curls or circles or leg lifts, all of it's all abdominal based. So again, not our favorite thing to do, okay? All right, continuing on here, what are some of the best exercises to do? So yeah, we're gonna get into that, but One of the ones that they really like are these, quote unquote low impact 10 to 15 minutes. That was weird. Something just talked to me here. Uh, we're going to get this low impact exercise, 10 to 15 minutes. Okay. Riding a bike, swimming, walking, or water exercises. So bike, I'm going to zoom out here real quick. Bike exercises, I think the bike is a great cardiovascular option for you to do. If you're on a stationary bike that's seated, recumbent style, the difficulty with this is you're in a 90-degree seated pattern or close to it. And your legs are out in front of you and you're propelling in this position where your hip flexors basically have to do a pretty good amount of work to maintain your posture to help you rotate your legs. Even though you're thinking like, oh, I'm in a reclined chair, this will probably feel better. It's rather difficult on the lumbar spine to hold your legs in that position. Even though they're sitting on the pedals and rotating, it can be still challenging to hold that posture proper. Unless you're going to be in one of these like road bikes where they can almost lay completely flat, in a recumbent chair kind of position, a recliner chair, and then bike out on the roads, on the paths. That's different than a recumbent bike where you're nearly vertical, in a 90-degree position or pretty well close to it. Better to just do the upright bike, in my opinion, like a regular, a Peloton or a Kaiser or whatever upright spin type bike that you would be on, because you're more vertical and you can work your legs down underneath you rather than out and in front of you. Challenges now are I'm going to round over or lean forward onto my handles. You want the seat height to be, when you're standing next to the bike, about hip height. And then you'd like it when your legs are going to rotate, they're about 2 inches from full lockout every time at the bottom, right? You don't want to have a full lockout of the knee, it will start to hurt the knee, but we want to have enough to where we can get a good range of motion and we're pedaling these, a full extended push down, but I also want to be able to have enough bite to pull on the way back up so my hamstrings can get some work ideally too. That can be a challenge if you don't have, clips and etc. But more upright biking, I think, is going to be more beneficial than a recumbent position. Walking, awesome. I don't think you need to do a ton of load in a ruck. If you want to ruck, I would definitely use the weight belt. That's what I do. The weight belt helps a lot. It takes most of the vertical axial pressure off of your spine, and the straps basically just hold the weight to your back and keep it from falling off. And then most of the weight sits on your iliac crest and along the belt line. Cinch that up, hold real tight. Shoulder straps should be rather light. Most of the vertical pressure down on your spine is pretty much reduced. So now I can still get the benefit through my hips and my legs of carrying some extra load while I go walking. Your gait in the beginning, in most cases, in my example, is as I start, my gait is very short, 2 feet, maybe with my steps. And as my nerve starts to loosen up, the hamstrings, my hip flexors, my glutes, everything start to loosen up, I can get to 2.5 and then eventually 3, if not more, feet in between. On my gait strides, I start to loosen up. This is a great way to stay active, still have your caloric deficit and get your steps in for the day, but also carry a little bit of weight and not hurt your spine or your back, make it any worse. I think that's probably one of the best ways to go. The next would be treading water rather than swimming. Treading can be very boring. My advice is get a waterproof iPad or anything that you can watch a movie or play music on or whatnot, put it by poolside and then just engross in that while you tread water. And part of my therapy, I built up to a point for about a half an hour where I was just treading water in a pool. Basically, when you're treading, you're either doing little egg beaters or you're doing little frog kicks or whatever it is. It's constant muscular activation and all these odd, weird angles, and it just helps create this muscular activation in a cardiovascular endured position to where I've got to keep doing this or else ultimately I'm going to drown. So I've got some good motivation to stay afloat, and you're using your whole body and all these odd angles. All the muscles are working. You're in a good vertical position. There's no axial pressure. If anything, you're actually reduced because you're more buoyant in the water. So you're probably reducing vertical pressure by, 2/3, something like that. I think it's a good way to go, but what are we missing is that you don't have any bone density activation on this. Like there's always a give and take with every exercise you do. So would you just say like, I'm just going to do treading, or I'm just going to do walking, or I'm just going to lift weights? No, we should do all three of them, okay, and find the options that work best for us. I think pool work is a very good way to go, especially in really bad flare-ups opportunities where your back is just super pissed and you're like, I don't know what to do. I just need to be active. If you can't walk, go get in the pool. That's definitely going to be a huge help, okay? The strength training, we'll talk about these exercises here soon, but we basically need to be in positions where your hips are going to be and your pelvis is going to be in a good position to not aggravate the nerve anymore. The pelvic tilt position is very difficult to manipulate and maneuver. Sorry for the in and out here, but basically your iliac crest, these are your, like, think of my hands as your cheeks on the back side of your butt. Your iliac crest are those the two sides of the pelvic bone. And at the base of them, there's this little tiny foramen. It's a little hole, and the nerve is going to go down the backside. So here's like L3, 4, 5. The nerves are all going to run out that, and it goes out that hole and stems down your leg. So that little foramen where the nerve is running through, when you tilt your pelvis, if you tuck your butt, or if you overarch your back and overarch your pelvis out, anterior tilt, posterior tilt, the nerve is running right down the center of that foramen. And as you tilt excessively one way or the other, you are going to see the activation, that pinching activation of the nerve in a negative response, okay? You'll really see this when we do the slump test and when we tilt our head. Again, I don't want to jump the shark. I'll show you all this in a minute. That's going to really aggravate and showcase, wow, this pelvic position is super important. And this nerve flossing, a lot of some other things will come in to kind of help us with this. But the pelvic position and that learning where to keep your pelvis so you're not going to cause more damage or cause more stimulus of a negative response is going to be pretty vital, pretty important for us. So they've got a little drill that you can do on here where you basically lay on your back with your knees bent and your feet flat on the floor like you're going to do a bridge. Place your arms along the side of your torso facing palms down. Gently tilt your tailbone towards the ceiling, tightening your stomach, abdominal bracing, hold for 3 to 5 seconds, lower your tailbone, relax back to it. Repeat that for 8 to 12 reps. Abdominal bracing in this position is basically in traction. You're pulling your rectus abdominis down through the floor as you kind of tilt your tailbone just a little bit to try to like flatten your lumbar into the floor and then relax and come back. That abdominal breathing has been a strategy and a technique for a long time to help, and it does help quite a bit. What are the best stretches for sciatica? Just straight out of the way, I would say the pigeon stretch is probably the best one, or any piriformis type stretch is going to really help with that opening of the foramen and allowing that sciatic nerve to feel some relief. With that being said, not every stretch is going to be made equal for every person. So they do kind of mention in there, everybody's is a little bit different and everyone might respond a little differently, but ideally, okay, this is pretty good. Before stretching, you want to do some type of light aerobic activity, typically walking or biking, just to loosen up. Okay, be careful of forward bending and or rotating the torso, rotations and opposite contralateral movements, left leg forward, turning to my right, etc. Can be rather difficult and can hurt me a bit. Do not force stretches when this is that whole no pain, no gain, no brain. This is definitely an injury where if you're hurt, if it hurts while you're doing it, stop doing that. You can't just force your way through this. You're only making it worse. If you feel muscle tense up, stop. If you feel excessive pain, stop. You've got to be really smart with this and understand that your lower back and your sciatic nerve is as sensitive as your eyes. So if you touch your eye and you're like, wow, that hurts, stop touching your eye. It's the same idea here. Like we can't push through this and it'll get better on the other side. Never stretch cold. I agree with that. Always warm up a little bit beforehand. And if you're experiencing pain, okay, there we go. Good. All right. So single knee to chest. This is, you're laying flat on your back, grab your left knee, pull it into your chest, hold for 15 to 30 seconds, release and switch. Both knees pulled to your chest. These are rather basic ones, but again, they work. Knees side to side. This one I do not like. This one is, we call knee knocks. You're laying on your back, both knees come to your chest, and you're going to tilt both knees, and you're going to turn them side to side. I'm not a fan of this one because your thoracic spine, okay, belly button up, let's call that. I know it's not exactly like that, but just to give you an idea, your thoracic spine and then belly button down, your lumbar spine. Your lumbar is not designed to rotate independently, meaning your L1 and L2 are not designed to kind of pivot and twist very well this way. They're bigger, they're thicker, they're fatter. The facet joints lock in firmer. L1 to L5, in my opinion, and this is what most of science will support, is designed to be still and take a lot of vertical force. That's why they look like and why they are built the way that they are built. When you go up into the cervical spine, they're really, really thin, they're super flat, and they're axial based, meaning they're designed to pivot and rotate and move about. And so that manipulation, the bobbleheady manipulation, is different. If the vertebrae in my neck were an inch thick and really thin, I would be stuck, and I don't think they would move or rotate very well because they're not designed necessarily to do that. So when we look at that knee tilt side to side, you're basically taking the lumbar and saying, you're not designed to rotate, let's force you to rotate. And or you're forcing the lower half to stay in the thoracic spine to try to manipulate opposite. Well, it just said don't do twisting rotational movements. You're like, yeah, but I'm laying down, so all the vertical pressure is kind of released. It's still rotation. You're still forcing something into that lumbar that I don't think is ideal for it to do. The lumbar is supposed to be still. It's supposed to be stable. Like if you were a puppet and I was going to manipulate and move you all about, I would reach into your spine, I'd grab you by your L3, 4, 5, and that's where I would do all my puppeteering. That's your center of mass, basically, is right there. It's not designed to pivot and to manipulate very well. It's designed to hold load and to be your center of mass. Everything else will articulate around that. That's why it's designed differently, why the discs look differently, why the vertebrae look differently when you move up and down the vertebral column, okay? So with that in mind, that's one I would suggest don't do this one. It's only caused me personally more discomfort and pain. To do thoracic rotation, absolutely. So laying on your side doing an open book, okay, where you're, or we call them reverse eagles, you're stacked on your side and you're gonna open one arm and then close the arm and then open the arm. Where the difference here is now my lumbar spine, sideline, is gonna be still. And my thoracic spine, the one that's lower, thinner, designed to pivot, that's gonna do the rotation. Now we're okay, right? Now I think that's the right call to make. I think you're in a much better position there. Supine hamstring stretch. Supine means face up. I'm gonna grab my leg straight up in the air and pull back. This is actually part of the testing protocol to see if you have sciatica. If you get up to 15 to 30 degrees of lifting your leg off the ground and you're already getting sciatic responses, that's rather severe. You should be able to get 45 to 70 degrees up, if not all the way up to 90 degrees to be able to get your leg vertical. And ideally you have enough flexibility, but if there's pain, etc., that's involved, like obviously don't do this one. Here's your cobra pose. I could not disagree on this one either anymore. Lay on your stomach, push your hands up. Some people get great relief from that. I just get massive explosions of pain and surging, piercing, stabbing down my ass. So if you try that and you get that response, stop doing it. And then the cat and cow pose, this is you're in your 6-point position and you're rounding your back, arching your back. I think the rounding up is really good and beneficial. It's the arching when you come back down. Keep your chin down and just kind of go back to neutral. I don't think you need to overly arch, and I think that can cause more pain than good, but the rounding of your spine, like pulling up like a cat when it's hissing at when it goes up like that, that position I think is really good because we're completely deloaded, hands, knees, toes. Like you're as supported in your back. The muscles in your back are not on to hold you. They can just work through range of motion now. And so this is a rather healthy and safe position to start to round over and let that stretch occur and then just kind of sink back to a regular neutral position from there, okay? All right, let's continue on. Getting into managing. Tips for managing this. There's multiple different strategies, so we'll talk about this. Applying ice to your lower back. 20 minutes several times a day. I think it does a great job of relieving some inflammation, specifically to exactly where the ice is being applied. Does it help you heal or rebuild or no? It's basically just kind of numbing out the pain, and that's very useful in some cases. So there's nothing wrong with that, but is it helping heal you? Not so much. The further we go into the world of rehabilitation, the more we're seeing that ice and cold water therapies and treatments and such, it has its place, but it's not doing as much as we thought originally. Like, doesn't do a ton of actually reducing inflammation. It can help the whole process, but not as much as we thought. The whole like 20 minutes on, 20 minutes off, the second you take an ice pack out of the freezer, it's already starting to cool. It's no longer frozen. So if you lay that ice pack down on the couch and then you lay on top of that with your knees bent in a traction position and you lay there for 40 minutes, you're not going to freeze your back off. You're not going to hurt yourself. It's already becoming closer to room temperature with every passing moment. The 20-minute marker is if I'm going to apply ice or cold water therapy that's being cycled, and it's always 32 degrees or 33 degrees so it can move through, that's about 15 to 20 minutes is what you're going to maximally want to put your body through, because it's not warming anymore. It's just always cold. And like, you can actually give yourself, you can put yourself into a hypothermic state through these treatments. I have done it myself. I got in the ice bath and I thought, okay, if 10 minutes is good, 15 minutes is better. And I got to 15. I'm like, what if I push this to 20? 20 minutes in a 40 degree pool. My skin was bright red. I was freezing for hours. I put myself into a hypothermic state. Really what you want is anywhere between 45 and 50 degrees of water, and sit in it for 5 to 10 minutes. I think that's going to be ideal. As far as a plunge goes, you're going to get your dopamine rush and all that, all that good stuff that goes through with having the plunge effect. But as far as the cold therapy of it, 5 to 10 minutes of that 45 to 50 degree water is great. Anything colder, it's just kind of a macho man test now. I don't think you really need to have it be that cold. In the 40s is great. Upper 40s is great. Some people have these lower back limitations and they feel that putting a hot pack on their muscles helps them loosen up and feel better. If that's the case, then go for it. Hot showers, soaking up the hot, the moisture, heat lamps, that kind of stuff. If that works for you, do it. In most cases, when you apply heat to something, it brings more blood flow to the area. That in many cases, you have damage done to that area, or a muscle is torn or whatnot. This is going to aggravate or make it worse in most cases. And where the ice slows everything down, allows a healing process, or at least it was thought to slow the blood flow down a bit to allow the healing process to occur, where more rushing, warm blood into the area can cause and do more damage. This is kind of old school thinking, but even today, the warmth feels nice in the moment, but ultimately in the end can be more damaging than good. Again, it's from person to person, but if heat makes you feel better and it's a value, then do it. Keeping active and avoiding laying down or sitting in one position for too long, very, very key. You can even set timers, like every 30 minutes I got to get up and walk around just for 30 seconds even, and just to kind of reset your back so it doesn't get stiff and stuck in one position. Over-the-counter painkillers, ibuprofen, Tylenol, etc., whatever. We're not even going to address like what you should take or how much or all that, but talk to your doctor. That would be ideal, but those things can work and do work. Nerve flossing. Okay, we're going to get into, instead of going through the instructions, I'm just going to show you. I thought this one of the funniest photos ever, but anyway, we'll go through here in a second. You're seated in the chair. Think of the nerves running around the backside of your body as like one long string. So if I am going to look down and pre-tighten that string around my glutes all the way up my back, and then I extend my leg out, I'm tightening it up around my leg, that activation that is going to incur a sciatic response that's extremely painful. So if I want to take that nerve and get some stimulus to it and kind of work the musculature around it, you can floss it, meaning that when my head is down, I'm going to flex my knees to take the pressure off the hamstrings, but allow the stretch of the posterior nerve, the grooved muscles or the muscles that are along the nerve path. I'm going to allow them to stretch from one end, and then I'm going to tilt my head up, putting the upper back muscles on slack, and then I can extend my hamstrings out and stretch the bottom. And then I'm going to alternate that back and forth and back and forth. I'll show you in a moment. I'll nerve floss here and show you in a moment. Doing that, 10 times, 2 to 3, maybe 4 times a day, this can help quite a bit. It definitely produces some relief, but it's incurring like floss back and forth in your teeth. It's not actually doing that, but it's, as far as the stimulus goes, it's running the signal and it helps loosen up the muscles that won't aggravate that nerve as much. The slump test is one of the tests that they use to see if you have high sciatic responses. You round your head over, look down at your belly button or look at the floor, and then you try to extend your legs. I'm going to show you mine in a moment. If you get tightness, pain, stabbing, etc., yeah, this is a positive slump test, meaning you have sciatic pain. Now, why this doctor is forcing this person into, I just put it in here because I thought that was pretty funny. When I showed Keegan, she goes, oh, maybe they're doing some manual therapy where she's having to resist. I don't think so. I don't really know why he's so hands-on, but I found that to be rather entertaining. Okay, so I'm gonna move back here just a little bit and give you all an example of a positive slump test. You can see me here like that. Okay, gotcha, yep. All right, so seated up tall. If I round over and look down, for me, I already have pain going down my left hamstring, but just in this rounded over position, boy, I have pain from my back all the way down to my foot. And then if I try to extend, that's about all I got. Definite pain. It's uncomfortable. My right side, I can go a little higher, but not much, okay? So that's a very positive test right there for sciatic responses. Now, beyond that, to do actual nerve flossing, okay, what I would do with this is, as I look down, I'm gonna leave my knees flexed so I don't have any tightness in my hamstrings, and I'm gonna work the erectors going up my back, around the top of my shoulders, all the way up to my neck. So basically musculature, when we talk about a posterior kinetic chain, the muscles are overlapping one to the next. From my occipital down, I have my levator scapulae, my upper trap. Those are gonna overlap into my rhomboids and my middle erectors of my shoulders. Those are gonna go down to my lumbar, QL, lower erectors over my glutes, glutes over hamstrings, hamstrings over calves, calves all the way down to my ankles, right? So those are gonna lap, 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 chain, chain, chain all the way up. If I can relax the lower half and stretch the top without incurring that nerve response where I'm like, ow, ow, this hurts, okay? So I can do this, and I'm actively pulling my legs back. So my hamstrings are on, they're just on slack. They're actively insufficient. So they're on, I can look down, that feels really good. But now if I just leave my head here and I try to extend my leg, I get a really negative response. I feel this sciatic pain. But if I lift my head up and look back, look how my leg can come up so much higher. So now I just flossed that nerve in one direction. Now when I bring my head down, if I bring my leg back, I'm gonna floss in this direction, and then I'm gonna floss back in that direction. And so I'm basically taking the nerve and not literally moving it, but stimulus-wise, I'm going floss, 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 like I would do to my tooth, right? Back and forth, back and forth. Same idea here. So as I look down, I pull in and I feel that stretch from, say, belly button up over the top, stretch. I can even round over. And then as I start to extend, I can lean back, and I'm trying to release all the stretch on my upper musculatures so I can stretch my hamstring on the bottom. And then I'm gonna come back down. So now can I do my other leg? Yep, I get a pretty decent response there. Little sciatic pain right at the top. Okay, round over again. Can I do both legs? Yeah, it's not great, but with each one of these, it'll get a little bit better. Again, I am pretty flared up, and it's 4 o'clock in the morning. So I've been, I haven't really done a whole lot of movement yet today. I came straight out and started to record this. But with each of these, okay, I'm slowly gonna get better and better. Now, should I be leaning back as much as I am? Probably not, but it's the only way that I personally can produce this floss without it aggravating or hurting me more. I feel good benefit just from what I did right there. Okay, and that was actually pretty solid, pretty successful in my opinion. Okay, so there's a start for us there to the flossing. I'm gonna leave this open because I've got a couple more things I want to demo for you, but let's just run through these here real quick. In summary, for this particular article, there's Ann Asher's info there at the bottom if you want to read more about her and what she does. This is something that can be an acute short-term response or can be a chronic issue that'll affect you the rest of your life. It's learning what you can and can't do and how to, when you have flare-ups, how to deal with them as we go. The symptoms, as we kind of talked about, just recapping: lower back pain, hip pain, the burning, tingling down the leg, a drop foot or any kind of difficulty in walking, difficulty in standing, or difficulty in the seated position. It just kind of depends on the person and where the injury is. The risk factors are 50 and over. As you age, there are greater potentials because we've had more time to basically abuse and use this. Our obesity, carrying an extra load, the prolonged sitting, diabetes, smoking, as we talked about, and just inactive lifestyle altogether. Diagnosis: go in to see your doc. Number one, they'll do x-rays to see if you have anything broken, MRIs and CT scans to check the nerves and the muscles and the discs and everything else in between. Treatment: you have physical therapy, okay, actually getting on hands-on, steroid injections, surgery, medications, all that kind of follow, okay, based on that. So there's your recap. One more article that I thought was really good. It's a little bit older. I think this is 2013 or 12, if I remember correctly. But Nicholas Rolnick did an article on working around a client's lower back pain strategies and exercise progressions. So he does a pretty good job of just kind of discussing the exercises and some of the things that you can kind of keep in mind as you go through the lower back limitations and the injuries. These are cautionary strategies, I guess I would say. Again, not including everyone, but the majority of folks are going to be able to experience different levels of pain, different levels of comfort, different lower back discomforts and injuries. Again, it's a very general article, and it's so hard to write these kinds of things or talk about them because every case is pretty different. Okay, everybody's pretty different. But generally speaking, he gives you this really good scale here of a 0 to 3 pain levels, and then 4 to 6, and then 7 to 10. Asking your clients to rate and use that is quite helpful. If it's a 0 to 3, that means that it's tolerable. You can handle what you're doing. We're okay to keep going. If it's a 4 to a 6, we're in that problematic area where things could get worse, or we can maintain and kind of work with this, and things will get better. But if it's in that 7 to 10, you're probably just going to cause way more damage than good. Lower back pain also has a residual response, meaning that in many cases you won't experience the pain or the discomfort right away. You'll aggravate your back picking up something off the floor or doing some type of movement, and in the moment the aggravation has occurred, even though you didn't feel a ton. You might feel, oh, that felt a little funny, or that felt a little odd, and then that's it. But then 4, 5, 6 hours later, the swelling has slowly come about. Things have slowly started to add up, and now you're like, oh man, my back really hurts. It's residual, meaning it's going to take a little bit of time for it to really kick in on the damage that you just did. So keep all that in mind. I'm going to show you this list of exercises here in a second. Then there might be some things where it's like, okay, we did this and it felt fine in the moment, leg press. But then 2 hours later, boom, my sciatica just exploded. The leg press was the cause of it. You just didn't feel it in the moment. And so when you introduce exercises specifically with people with lower back injuries, pick your 4 or 5, so easy, so basic, do it. And then exercises, do them. And then later that day, check back in with a client and say, how do you feel? And they're like, I'm good. You're okay. Okay, cool. We've got a starting point. Now from here, every workout we do, we're going to add in one new thing or change one new thing. And if you do that, when you get to any new exercise, okay, one particular exercise, whatever it might be, and there's a negative response, now you know which one caused it. Because the original 4 or 5 exercises that we plugged in didn't cause a response. You did fine every time we did seated rows, seated overhead press, seated chest press, and seated pull down. But then the one day where I take you away from seated and we do a standing overhead press, your back blew up afterwards. We know exactly what the culprit was because we changed nothing but one thing. If you do 5 new exercises and the next day do 5 new ones, you don't know what caused the pain and which one didn't. And again, you're not going to know it in the moment in most cases. It's usually going to be residual a couple of hours later. Okay, it takes time for that aggravation to kick in. Where with a torn ACL, every time I would squat, my knee would go, ow, ow. I'd be like, okay, this is hurting me, right? Stop. With your back, that's not exactly the case. I could hinge over to pick up the mat. That's what hurt my back, but I won't feel it for 2 hours from now until it slowly swells up and starts to aggravate. But that was the culprit, okay? So keep that in mind as we go through. Using the pain scale, I think, really helps quite a bit. And then this is a great little chart here that just kind of shows if you're going to do horizontal rows, like the most basic, most simplistic one is a chest supported machine row or a prone supported dumbbell row. That's the most basic, most safe, most comfortable. It's rather easy to do, and you can make it hard just by increasing the load, changing the tempos, etc. But to make it a little bit more difficult, we could do a 1-arm stabilized row, like your typical 3-point row, or a cable seated row. And then to make it even more difficult, we would do what they call a dead stop barbell bent row. That's your traditional, I'm holding a barbell, I hinge over, hold it, and then row, return, okay, or barbell bent via like a landmine, something like that. And so with each plane of action, each movement pattern, they kind of give you this, okay, let's do bridges as a basic hip hinge, then let's go to the trap bar, and then let's go to a traditional barbell deadlift, right? Or something along those lines. So it's a great little chart to use. And like, all right, I want to be able to do some vertical pulling today. Last time we did our machine assisted pull-ups. Is going to pull up the next best thing, or should I try the cable pull down machine? Well, let's do the cable pull down machine. Kind of gives you a little idea on some progressions to look at. Okay, other things to keep in mind here too are your ergonomics when we have somebody sitting at a desk or properly picking up. Just think about the positions that you're in on a regular basis. Rounding over the back. Hey, doctor says don't use your back when you pick things up. Well, I need to squat down to pick it up. Better stand right over the top. Get down into that position. You should straddle the implement or the box and then get into a deep squat, butt out, chest up, proper position to pick up versus just the rounding over and hurting the back. And then at the desk, can you stand at your desk? That would probably be the most comfortable thing for your body. Seated, can I have my chair height in the right position where my butt's a little higher than my knees? My eyesight is straight across instead of looking down. My mouse pad, my wrist, my elbow, everything's at a 90-degree angle or more, as opposed to less than 90 degrees, round and no back support, etc. It's the little things. All these little things add up, okay? Big time, they add up. Books that can help quite a bit. The Ultimate Back Fitness and Performance. This is a great one. Stuart McGill, he's written a lot of books, including The Gift of Injury. One of the better books, I think, with Brian Carroll, looking at a world-class level athlete, power lifter, blows his back up, and Stuart kind of helps rebuild him. And then another book is called Built from Broken. These are all, I feel like, pretty excellent books. One more that doesn't specifically address lower backs, but as you're an older adult, this is a great book. My favorite here, Fitness Professional's Guide to Strength Training Older Adults. You'll notice all my books have these little tabs on them. I think this is one of the best reference tool type techniques you can do. I know it's old school, but when you go through a book and you're like, man, what did he say about sciatica again? What did they say about pelvic tilt? I can get right in and right back to the page that I want to be at and discuss that specifically. What did he say about abdominal bracing? Boom, I'm right back into abdominal bracing and how can I do that? Yeah, Stuart's using, force plates and all kinds of great stuff on here to check axial loading, etc. So really good one there to check that out. The Gift of Injury is a little graphic. It shows, and this was super cool. Stuart signed this one for me. I got to meet him in person. Very cool guy. But he goes into cadaver parts basically and shows how putting these cadavers on these machines and like pushes them until they explode. Crush depth basically, okay, is what he takes these guys into and shows these discs that start to blow apart. It's rather graphic, and there are some videos of this you can get into as well. Yeah, here's a chunk. There's a cadaver piece right there for you. That's a disc, if you can see that. Try to get that focus here again. There you go. There's a disc that is blown apart there. Pretty graphic, okay, but you can check that book out. And then Built from Broken, this is a great book, especially the first half. Goes into some really good detail on how to train with injuries. You can see I've made many, many notes in there. Great book, and he gets into some of the exercises towards the end, okay? So good references there. All right, what do we need to know as coaches? All right, Stuart McGill has his big three. I want to review those with you here really quickly. The first one is just a basic, like a curl up or how to get up. Let me get into the right position here, more this way. My camera angles are a little bit backwards. There we go. Okay, so the curl up is basically just an abdominal brace. You want to slack one leg, okay, from here. He's got the arms. You can be palms up or palms down. And then you're going to curl up, and we're going to hold this position for like 8 to 10 seconds, okay? And then from that position, after 8 to 10 seconds, you're going to come back down, relax, and then re-engage and come up. So this is practicing the abdominal brace, but you're creating a slack by putting one leg, and usually it's the aggravated side, putting that leg on slack by flexing the knee. It's releasing the pressure of the hamstring. Even though I'm straight legged, it's still activating and elongating that hamstring. So I'll get my abdominal brace. I'm pulling my belly button down like I'm going to start to get up. So I'm pushing down, but this is also holding my pelvis in a neutral position, and then I get to relax again. Okay, this is a great way to practice that abdominal bracing and kind of get some musculature to engage, build some endurance, and then relax. Again, 8 to 10 seconds, 8 to 10 reps. I think somewhere in there is pretty solid. Okay, the next one is the side plank. I am a big, big fan of doing these on my knees. So I like this position better as opposed to the long legs. Number one, you got a lot of lateral pressure on your knees, but it's a long lever for your body to work. So I think starting off here really short, you're gonna push your knee down into the floor, push your forearm and elbow down into the floor, and then you can just hold this side plank position. Knees stacked, nice straight line here on the body. These guys are gonna start to work more of the lateral stabilizers, where we were working more of the anterior and hip flexing based muscles on the original curl up. So you'd hold this, 30 to 45 seconds, switch over to the other side, knock that one out. You can make this more difficult by holding a weight, putting it on your hip, or holding a weight on your arm. Okay, you can do that if you want to. Extending the top leg here too will get a little longer lever and gets you a little bit more activation in the glute, but just be careful, not to start to aggravate any sciatic symptoms in attempting to do exercises that are designed to be more therapeutic, okay? And then our last one here is just a traditional bird dog. Hands, knees, toes, 6-point position, okay? That means I've got my toes engaged too, as opposed to pointing my toes down. I want my musculature to be on my feet. I'm gonna reach my left leg out as long as I can via the heel, and then reach my right arm up, reaching as long as I can via the knuckles. And I'm trying to elongate cross-sectional left foot to right hand as long as I can, hold for a second or two, come back. I can do repeats of the same side, or I could alternate as I come down and switch to the opposite. We're worried about length on this, not about height. I'm not trying to lift my arm and my legs higher to make like a U. I'm trying to get as long as I can, okay? Length is really key to this. And then one of my faves, and it's in my next one. So I have McGill's big three, and then I have Linkle's like moderate size three. Just kind of having some fun with the big three. I'm no Stuart McGill. This third one down is the half kneeling windmill. I really like this one, and I think it's probably my favorite mobility to do, but also I load this. I'll show you a video in a second, and I do half kneeling loaded hinges. Pivot your back foot so it's opened, okay? My hip is now open to the side, and I can put both my hands down onto the floor, and just holding this position here is already giving me some pretty good relief, in almost like a little bit of a traction position. And then you can reach, add this rotation in here, and I push my hip back and away, and I get this great QL stretch. My external, internal obliques, my lat, all of that just kind of working up the backside of the lumbar. I get this great stretch, this great traction relief here as I'm pushing my hips away and kind of reaching my upper body opposite that. bring it back down to the floor, and then rehinge. Hinge down, I'm pushing my butt out and up, so I'm getting a good pelvic tilt position. Then I rotate and reach and kind of shift and just work in here a little bit. Okay, this is more of a mobility-based component. I do a lot of these to warm up, but eventually you can hold 2 weights, a weight in each hand, unload them on the floor, and then return here. Unload on the floor, and then return. My one above that is called a hinged pull down. So imagine, I don't have one set up, but imagine a band or a pulley out here in front of me. I'm hinged, and as I'm pulling on the weight's going to traction and pull me. It's going to separate me a little bit as I'm kind of sitting back against it. I pull down like a chin up, and then I allow it to pull me up long again. I pull down, contract, bring it together, and allow it to pull me back up. Every time the weight's kind of tractioning, elongating my spine. Really great there. And then the last one is just a suitcase carry, holding a weight in my right hand as I'm carrying, walking along. I'm basically having to work my opposite side musculature on like a X and Y axis to not allow that X or Y axis to plane. I have to hold and maintain like I'm holding 2 weights even though I'm only engaging on 1. So I'm going to get this opposite side musculature activation to occur and to assist me in keeping me in a rather upright position. And if I'm holding my right, it's going to target my left QL, left lumbar, left oblique, basically the whole left side. And that's going to keep me from over tilting or overcompensating. It's going to keep me in a good postured position. I can carry for a while. I'm getting a muscular endurance component, but I should be carrying a fairly heavy load. So that's also going to help me build some good muscular strength there too. And any imbalance that I have, meaning if I'm really strong on my left but not on my right, if I carry a weight in each hand, I don't really get to change those ability levels from one side to the other. They're basically both countered by the opposite load that I'm holding. So as long as I'm strong enough to hold a 50-pound dumbbell in each hand, they kind of counter each other. I can just balance in the center. But if I put one of them down, well, now I no longer have a counterweight. I just have 50 pounds on one side. Now my musculature has to really hold. Even though I've cut the weight in half, maybe I hold a 70-pound dumbbell. So it's not the 100 pounds that I was carrying, but one side is 100% responsible for all that load being in the right position and then switching to the other side. If I have any kind of imbalance, I can slowly start to creep those imbalances up and make them fairly equal, or at least seek equality, if you will, as we kind of go through our training. That should, as you get stronger there, reduce some of the symptoms and reduce some of the issues that you're having. Reminders: no pain, no gain, no brain. Be smart, okay? If it hurts, stop doing it. Traction and deloading the hips help quite a bit. These are therapeutic activities and therapy-based movements to do. So I'm not going to cover them in this video, but that is something that you should look into. Some tractions and self-tractions are really great. If you have hip replacements, please be careful and make sure you're not causing more harm. I'm going to dislocate one of your hips trying to relax your back. Now we have even bigger issues. And then the belt squat is probably one of the best alternatives, if not the best alternative for deadlifts. The axial pressure, the axial loading that you get from a deadlift or a goblet squat or a back squat is reduced by anywhere from 80 to 95% when you use a belt. Think of a belt that you would hang a 25-pound plate from when you were going to do dips or chin-ups, like one of those belts that just kind of loops over your hips, and then click that into a 100-pound kettlebell, squat down. The kettlebell should touch the floor. You can deload it for a second and then stand back up. It's a great way to take all that above the belt line, because the belt's over the top of the iliac crest along the hips. Your vertebrae then run right up the middle of that, and there's no pressure pulling down on them. Why is it not like 100% reducing? Because you still have valsalvic pressure from your breathing, and there is still pressure of the belt being around your hips. So it's still in that area, and you're going to still feel pressure. It's just not going to be nearly as much as if the weight's on your chest or on your back or over your head or down on the floor as you pull it right off the ground with a deadlift. So there's a pretty good alternative in belt squatting. You can get, 100 to maybe 150 pounds of kettlebells, dangling off a belt. But at some point, if you want to do more, you're going to need some kind of setup, some kind of device, a pivot or a landmine or a lever or something that's going to give you an opportunity to click into it and then squat it. If not, just a full belt squat rig or device. And there are many: Rogue, Titan, there's so many. There's a bunch of them out there. So almost everybody makes some variation of a belt squat. What I would caution you on too are these short little levers that like hook onto your squat rack and you just slide plates onto them. You need to be able to get over the implement and be right over the top and have the load dangle straight down. You don't necessarily want it to be on a pivot, because as you are manipulating it, the lever of the arm is going to change how much pressure you have. At the top, you'll maybe have 100% of the load, and as it goes down, it'll be less, but it's also going to pull you forward or pull you back. So yes, there are alternatives to using a barbell on a landmine or something like that, and it's better than doing your trap bar deadlift or whatever variations you were doing, or a back squat. But ideally, you would just be straight over it. You'd literally be right over the top of it. Like if it's in a cylinder, this is where the Titan one I really like. My buddy Steven has it. It's basically a cylinder. You stand over the top on a platform, and all the plates are straight up and down, and they're on a pipe that runs right up the center of the plate, and you just click in and stand up and go down. It can't go anywhere other than straight up and down the bar. The plates are stuck in place. They can only ascend and descend. They can't move forward or back. You're right over the top of this thing. And so you get to manipulate your body where you want to, but the path of this is straight up and down via your spine. Like, it's one of the better, if not the best option for you to utilize if you're going to belt squat, okay? I will put some belt squat tools in the link for this video as well. If you have any comments or questions, please feel free to let me know. Here's a little PDF guide for the Stuart McGill Big 3. And again, just to recap of mine, the suitcase carry, the hinged pull down, and the half kneeling windmills, I think are all really good options for you. Anybody that's not a TOA Select member, I just wanted to give you a little highlight and look into that real quick. We work with everybody from basic trainers, independent, working on their own, to, you've been in the field for a couple of years, you're trying to level up, all the way up to I've got my own place, or I want my own place. We've got all kinds of different options. We teach you all of our signature courses of getting you certified, our ADLs, DLFs, S&Cs, all of our different programming. We have all kinds of different levels there. We cover everything from fall prevention and stability, balance, coordination, cognition, power development, dynamic movement patterns. We've got 350 different exercises in our library. We have guest speakers, hot topics, new content put out every month, new topics put out every month. And we cover everything you need to know about osteopenia, sarcopenia, and obesity, the big 3 in training the aging population. So if you have any questions, you're interested in becoming a TOA Select member, please let me know. Feel free to reach out, and or just check us out on the website, trainingtheolderadult.com, or on Instagram, and you can see more information about us there. If you're on YouTube and you're watching this, I hope you enjoyed it. Thank you for being here. All of our Select members in-house, all of our FitBody members in-house, thank you all for being here as well. I hope you got a lot of good stuff from this. This was a pretty deep dive into this topic. We needed to discuss it. We needed to talk about what this issue is, what we're going to experience, what exercises our clients probably should and should not be doing right now. And these are going to be challenges, as you're going to have to ask your client in the moment, hey, how does this feel? Step ups, we doing okay? We're not. We'll get into maybe a part 2 on this, where we'll look at each movement pattern, and I'll give you something similar to that article and how it kind of showed you some reductions and progressions, regressions, etc., that you can do with your clients from exercise to exercise. I'll think about a part 2 and put something together like that. I think that should be a helpful tool. But until then, I hope you got some good stuff from this. Comments, questions, hit me up down below. Don't forget to like and subscribe and be a part of the channel here for us. If you're on YouTube, we appreciate it. Everybody, we appreciate it. Anyone viewing, wherever you're at, thank you all so much. Hope you have a great day. And as always, continue to fight your good fight against sarcopenia. We will see you next time. Take care.